Hello, I'm Dr. Zaneta Forson-Dare. Welcome to HEAL Module 8. This module was kindly written by Dr. Johnson, and today we're going to be talking about maternal, perinatal, and child health. So let's get started. Okay, so we know that Black women disproportionately face challenges and disparities that affect their maternal health. And societal and healthcare system factors contribute to these poor health outcomes as well as maternal mortality. We have issues like lack of access to prenatal care, racism, racial bias, implicit bias, socioeconomic status, mistrust of the medical community. And because of all of these reasons, maternal mortality rates remain high in Africa, in the UK and the USA, as well as the rest of the Black diaspora. Important to note that even when you account for socioeconomic status and education level, Black women in the USA still have higher rates of maternal mortality and morbidity than their white counterparts at the same socioeconomic or education level. Let's go into a bit of these challenges in a bit more detail. A lack of access to prenatal care can be caused by financial issues, transportation problems, issues in the geographical distance between, clinics or medical centers. It's important to note that the type of job someone does may also impact their ability to take time off work and their ability to lose earnings and what that would mean for the financial security of their family. In terms of the United States, more specifically, we can think about issues around insurance and immigration status. There is a historical medical mistrust in the healthcare system. The healthcare system obviously exists within the wider construct of the society, which we know has systematic racism. And so therefore, as one of the systems that's within the society, it is also impacted by racism and is going to lead to mistrust from patients of color and from Black patients. This has also been contributed to by a history of studies and tests being done, or even treatments being done on Black people, Black women against their will. For example, the Tuskegee syphilis trials, amongst many other examples that can be given. Then we have issues of racism, racial bias, discrimination, and implicit bias, which can lead to dismissive care from healthcare providers, a delay in treatment, or a reduced quality of treatment. Socioeconomic issues feed into all of the above, but again, financial constraints are going to decrease the ability of women to even focus on maternal health and focus on healthcare outcomes, as well as reduce access to prenatal care, to healthy food, to exercise, to rest. And then also we have a lack of culturally competent care. We know that care needs to be culturally humble as well as accessible to people in order to change or improve care, as well as to adjust behaviors that may impact on care. One of the other topics we'd like to talk about today is childhood vaccine hesitancy in the Black community. This is rooted in both historical and contemporary racism, marginalization, and neglect. Again, historical movements and events, such as the eugenic movement and Tuskegee syphilis study deepen that medical mistrust that goes on today. And we know that vaccine hesitancy or mistrust in the vaccine system is a multifaceted problem. So there's the overall mistrust of the healthcare system as it exists within the infrastructure of the society that they live in. There's mistrust of the healthcare provider to provide equitable care. People do not trust the government to give them safe information or truthful information. And there's also mistrust in the actual vaccine as to whether it will be safe and effective for their child. We do know also that childhood vaccines are a significant public health advancement and success globally. There are many diseases that have been significantly reduced, and their morbidity has been reduced, and mortality too, because people are widely vaccinated. So while there are very justified reasons for vaccine hesitancy in the Black community, education and promotion of vaccines are really essential to prevent the worsening of any healthcare disparities. In the US, they did a study and it showed that low-income families were 30% less likely to vaccinate their children between the ages of 1.5 to 3 years. And Black infants are still less likely to be fully vaccinated than white infants, and which again brings up this connection between race, income, and also vaccination. It is very much a priority, however, for us to close this gap in vaccination. We need to identify the barriers as above and then address them individually. We need to partner with trusted community voices so that we can produce culturally appropriate materials and also explain and educate people in a way that acknowledges their real fears and acknowledges their concerns that are rooted in truthful things that have happened and are rooted in a real mistrust of the system, healthcare system at large. Community-based outreach programs and creating convenient locations for vaccines to eliminate transportation barriers can be very effective as well. Okay. So talking a little about infant mortality. So infant mortality is the occurrence of death within the first year of a child's life. In sub-Saharan Africa, some of the main reasons why this happens would be prematurity, low birth weight, which often goes along with prematurity, birth asphyxia, sepsis and infections, as well as other maternal complications, which probably include things like abruption, uterine rupture. Within the Black diaspora in the Western world, were also again the higher rates of low birth weight, higher rates of congenital malformations, increased rates of sudden infant death syndrome, accidental injuries, and again increased rates of maternal complications lead to can also contribute to increased rates of infant mortality. Black infants overall are more vulnerable due to lower birth weights, and Black mothers are less likely to receive prenatal care and may receive late care. It's also important to note that even within infant mortality, issues of racism and racial bias can also contribute to increased infant mortality in Black children as compared to white children. There are other issues, other childhood illnesses that disproportionately affect the Black community. Some of these include a higher risk of exposures to pollution, which is a very key factor in the issues of asthma and allergies. There are higher rates of learning disabilities, thinking about that within the context of the education system and how different children are taught, and how the quality of education that they may be receiving depending on their location and where they live, and the racism within the education system. There's also issues with higher rates of obesity, and then type 2 diabetes are very closely linked. And these disparities exist because of this complex interaction between both individual genetics, the environment in which they reside, their family history, the socioeconomic factors that affect every aspect of a child's life, and then cultural factors too that may be more individual to each group of people. So a little bit more about asthma. So asthma has been a major public health issue since the mid-1970s. The main risk factors are going to include family history and then also allergen exposure. The families who have lower socioeconomic statuses with lower income, therefore are more likely to reside near higher polluting sources. So that's closer to industrial plants, closer to major roads with lots of traffic, and more likely in large or high-rise buildings that may be older, may not be as up to code, more likely to live in apartment buildings with less, or flats with less control over the environment, over the temperature of the apartment, and also less control over improving issues with pests or mold or dust. And we know that because of all these reasons, higher toxin exposures disproportionately affect children from lower income backgrounds, which triggers this constant cycle of asthma and asthma attacks. So it's really important. Children that experience, coughing, shortness of breath, inability to keep up with their peers for exercise, it's very important for them to have prompt assessments by a pediatrician or a general practitioner to assess whether or not this could be asthma. And then once that asthma diagnosis is made, the effective management is multifold. So we're thinking about removing triggers, giving regular medication, and also regular checkups to reduce illness. And once asthma is more controlled, it impacts a lot of different parts of a child's life. So less time in the hospital. Well-controlled asthma leads to less time in the hospital, which means less A&E or ED visits for the parents, less time away from their work and their ability to financially support their family. It means that children will spend less time out of school, and so won't also then be affected on the education side by being behind their peers. There are other things, so a few other illnesses that we wanted to kind of bring up this time, things like lead poisoning. Lead poisoning disproportionately affects children in lower socioeconomic statuses because it's often it's an environmental issue in older houses. And lead poisoning can have neurodevelopmental impacts, and so can significantly affect education and neurodevelopment as a child grows older. And then again, obesity and type 2 diabetes, which are very linked. Obesity has been shown to disproportionately affect Black children. Factors such as food insecurity, food deserts, lack of access to medical care and healthy food, lower socioeconomic statuses, so the ability to buy, we know that healthier foods tend to be more expensive, and also cultural factors have been contributing to this issue. Type 2 diabetes as well, which is very closely linked to the higher rates of obesity, again, are disproportionately affecting Black children. And it can be related to obesity, to genetics, as well as lifestyle factors. So we've come to the end of the slides. This was very, very interesting. And I think that the first step for addressing anything is to really understand what is going on, and it's now been well documented for several years, the disproportionate impact on Black women, on Black children, and Black infants. And so I'm very happy to be a part of this. If you have any questions, please leave us a message, send us a DM, or an email, and we'll be happy to discuss any of these issues further. And also I've left up the references if you want to take a closer look at some of these numbers or at some of the studies that we talked about. All right, thank you very much.